Hello, my name is Eric Schaefer, and I am one of the medical oncologists here at Highlands Oncology. What we're here to do today is to discuss the Teen Cancer Challenge and how through the Teen Cancer Challenge we can help people in Northwest Arkansas beat cancer. Every 30 seconds, someone in the United States hears the dreaded term, "You have cancer." When you tell someone these words, you see the blank stare that comes across their face. Tears well up in their eyes. There's a violent collision of emotions. Fear, despair, grief, guilt. With your help through the Teen Cancer Challenge, you can help provide another emotion: hope. According to the American Cancer Society in 2015, almost 850,000 men and 810,000 women will hear the dreaded phrase, "You have cancer." To put that a little bit differently, 1 out of every 2 men and 1 out of every 3 women will hear that dreaded phrase. Cancer affects everybody. It does not care if you're white or black, rich or poor. It does not care where you go to church, nor who your school mascot is. Cancer does not care. Last year alone, the Cancer Challenge was able to raise more than $750,000. Through these funds, we're able to provide support to many worthwhile organizations. These organizations include Circle of Life Hospice, Hope Cancer Resources, the Mercy Foundation, the YMCA, the Cancer Support Home, and the Community Clinic. These funds are necessary to help your neighbor, your aunt, uncle, or your friend beat cancer. But I'm not here today just to talk about cancer statistics. What I'm here today is give you real life examples of how your funds through the Teen Cancer Challenge help people beat cancer. KS was a patient of mine who I met in 2009. At that time, he was a normal high school freshman. He was going through the typical freshman blues: new responsibilities, new friends, lots of homework. However, in December of 2009, KS developed testicular pain. This prompted emergency surgery. A week and a half later, with his mother and 2 little sisters surrounding him, I had to tell KS the terms, "You have cancer." Now, KS had a very treatable form of cancer. However, it required aggressive IV chemotherapy. Now, the types of medicine that KS would be receiving is classified as highly emetogenic, meaning without the appropriate anti-nausea medications, he had between a 60 to 70% chance of having severe nausea and vomiting leading to dehydration and potential kidney injury. I remember reviewing all these potential problems with KS and his family and giving them the prescription for the appropriate anti-nausea medications. I said, "We'll treat you and I'll see you in a week." A week later, KS came in very sick, dehydrated, and could not keep any food or water down. I said, "What happened? Did you take your medicines?" He said, "No." I said, "Why?" He said, "I could not afford them." That was my first real-life encounter. Wow. Thankfully, here in Northwest Arkansas, we have many organizations that can help. Hope Cancer Resources was able to provide KS and his family the medicine to help prevent this nausea and vomiting. HOPE can do many other things though. They can prevent with cancer screenings. HOPE is also able to provide counseling services. They're able to provide emergency finances to help provide money for food and electricity. These funds would not be provided without the Teen Cancer Challenge support. Thank you for helping KS beat cancer. The next patient is AH. AH was a 22-year-old female who's referred to me for an elevated white blood count. After reviewing her blood film and performing a bone marrow biopsy, we were able to confirm she had the diagnosis called chronic myelogenous leukemia. I remember her sitting with her 2-year-old daughter in her arm and having to tell her, AH, you have cancer. Now the type of cancer AH had was something called chronic myelogenous leukemia. This used to be a death sentence with a mortality rate of 75%. Thankfully, in 2001, a groundbreaking new medication called Gleevec was on the market. This medication changed lives. Unfortunately, the cost was $91,000 a year. Unaffordable if you did not have insurance. And unfortunately, AH did not have insurance. I did not know what to do. We went through the normal channels, but we still could not obtain this medication for AH. I had one thing last to do. I contacted the community clinic. Through the miraculous work of the community clinic, we were able to obtain Gleevec for AH. And I'm very pleased to report that this past spring, AH is still in remission. Thank you for helping AH beat cancer. Now, unfortunately, not every cancer story has a fairy tale ending, but you can always help them beat cancer. The last patient I'd like to talk to you about today is HM. HM is truly a remarkable man. At the age of 72, he was diagnosed with rectal cancer. His treatment would include 35 treatments of radiation therapy in addition to continuous IV chemotherapy. However, at the time, his only stipulation was he would only take the treatment if he could still work on his farm. HM was a true farmer. When he was not working on his farm, he was helping his neighbors. Through the chemotherapy and radiation, HM beat the cancer. Unfortunately, in 2013, he developed difficulty swallowing and was diagnosed with a second cancer, an esophageal cancer. His treatment would be very similar to the first time, a combination of concurrent chemotherapy and radiation. Unfortunately, this time the outcome was different. The treatments did not cure the cancer. We had one thing left, a radical surgery. However, if the surgery was performed, we could not promise HM that he could perform the normal activities he loved to do. He said, if you cannot promise I can be a farmer, I do not want it. He finally agreed to a low-dose form of chemotherapy that he knew would not cure him, but it would allow him to maintain the quality of life he so desperately wanted to maintain. 18 months later, as HM was lying in his hospital bed, thin, sick, and tired, he made me a promise. He said, I want to go home to my farm. That is where we have Circle of Life. Circle of Life is a wonderful organization whose goal is end-of-life care. They know that while we can't cure all cancers, they can offer death with dignity. Through Circle of Life, we're able to allow HM to go home and spend his last days on his farm. While he might not have survived cancer, I promise you, through the efforts of Circle of Life, HM was able to beat cancer. Thank you for letting HM beat cancer. Unfortunately, our work is not done yet. This upcoming week, at least 20 new people will hear the dreaded phrase, you have cancer. But I am confident with your continued support, we can turn that phrase around into the phrase, I beat cancer. Thank you for all your support.